Talk about the big development first as far as COVID-19 is concerned, because the wait for children's vaccine above the age of 5 has surely been a long one in India as compared to the rest of the world. Children across the world have been accessing the COVID-19 vaccine for almost a year now, but Indian children have still not been given that opportunity. Now, there's a host of reasons that experts have been talking about so far, and the primary one among them is that seropositivity surveys show that a large number of Indian children have already been infected and have got some sort of immunity. Also, there is enough data now to show that when children do get infected by COVID-19, it's not really that serious. They have mild symptoms and no real major problem in terms of symptoms or the afterload of COVID-19. Hence, there was no rush as far as children's vaccine is concerned. But now we have a situation where cases are rising up a little bit. A lot of anecdotal cases that kids have gone back to school and are getting infected. Perhaps that could be one of the reasons that the DCGI has now approved 2 vaccines for children in the age bracket between 5 to 12. So, Bharat Biotech's covaxin has been granted restricted use authorization for ages 6 to 12. Biological E's Corbevax has gotten an emergency use approval for kids in the age group of 5 to 12. Meanwhile, Zydus Cadila's ZycovD, which is a 3-dose vaccine, has been approved for kids above 12. The upgrade in India's COVID arsenal comes at a time when the risk of infections among kids is expected or believed to be high. Now, what are the concerns that may be in parents' minds? We're thinking about that tonight when we're talking with Dr. Rajib Dasgupta from the National AEFI Committee. Dr. Dasgupta, thank you so much for speaking with us this evening on the India development debate. And I was keen to speak with you because for most parents, the big concern is whether they're going to be in any adverse effects. Do we have enough information to know what happens to kids many years later if they take this vaccine? I mean, anecdotally, this is what parents talk about. What would you say to them today?
Thank you. COVID is a new disease. All the COVID vaccines are new vaccines. Therefore, what would happen years later is something certainly we don't know. However, as far as the National Adverse Events Following Immunization Committee goes and its various state arms and district arms, we are certainly gearing up, managing, investigating AEFIs in children, or what we call CYP, child and young population, that requires somewhat different protocols, which means that we need to recalibrate a lot of things. This would require a different kind of alert, and therefore this is certainly a new challenge, both vaccination as well as keeping track of AEFIs and managing those.
In the data we've seen so far globally, Dr. Dasgupta, is there any indication of any AEFIs or any kind of adverse effects as far as kids are concerned with the COVID-19 vaccine? And is there enough data on the AstraZeneca, for example, or the covaxin?
Well, the covaxin in India, we have had trials, and therefore what the subject expert committee and finally the DCGI has shown the green flag on is on the basis of that experience. Yes, there have been incidents of myocarditis in some of the mRNA vaccines in younger populations. However, the child vaccination or childhood vaccination against COVID has also been going on at a very, very large scale across the world. At the same time, as you were discussing earlier in your presentation, that COVID, and this again, global data suggests that COVID infection among children and young population is essentially mild in nature, and COVID mortality is certainly very low compared to all-cause mortality in these age groups. And that's why we have really maintained caution in introducing it not too early. And despite some of the outbreaks or increase in cases that we are seeing in schools, children and young persons are certainly a lot safer with COVID infections than with older adults.
So, Dr. Dasgupta, now where are we in the process? We have the DCGI clearance for these 3 vaccines, which I mentioned in the beginning of this conversation. So how far are we from rollout?
Well, I can't exactly give you a
What
date
comes
or number
next?
of days,
Let me
but what comes
let me
next? Yeah,
reword
what
that. What
comes?
are the next steps?
So the next steps are, as we have seen with the earlier vaccines, uh, either this will be rolled out in terms of schools. There will be camps in schools. There will be this will have to be made available through health centers, health institutions, public, private. Now these operational details, whether it's going to be free, whether it's going to be priced, these are decisions that the Ministry of Health and Family Welfare, the Immunization Division takes. Of course, there's a blueprint. Of course, the government's effort is to roll it out as soon as possible. But at the same time, it must be made clear that immunization should not be, or rather to be specific, COVID immunization should not be taken as a prerequisite to schooling. Some countries, of course, have prioritized children who need it more than others. For example, those with childhood cancers or immune deficiency of any kind, because they would be more vulnerable to the infection. But we still don't know whether we are going to see that, or that all children would be eligible at the same time. These are some of the operational details that we should be able to learn about soon enough.
Dr. Dasgupta, for those who are today wondering whether they should take this decision for their children or not, and the thinking is that if it's not going to impact them too badly in any case and just build their immunity, why risk with a relatively new vaccine? What would be your response to them?
One, as with any vaccines, we need to respect that opinion or views or perceptions of parents, one. Second, depending on the risk perception of the government, the risk communication messages should be adequately tailored. Now, as you said very rightly in your opening presentation, the seroprevalence in India among children has roughly been 10 percentage points less than adults. In other words, children are also protected to a significant extent. And therefore, we haven't really seen any large-scale outbreaks among children. What we see now, somewhat of an increase in schools is always, COVID in children is always depends on what's happening to COVID out in the community at the population level. In other words, the obverse that doesn't happen, that a school outbreak leads to an outbreak in the community, or at least that's the global experience so far. So if there's a general surge going on, we certainly expect some cases in children too. And finally, those children who have other comorbidities, which would obviously be much less than adults with comorbidities, they should certainly be in touch, in consultation with their own pediatricians and treating physicians.
Just last point, and you mentioned this a little while earlier, but I think it needs to be underlined. You talked about how vaccination should not be a precondition for letting kids into school. And do you think that this is really crucial?
I think this is crucial because there is anecdotal evidence that schools are insisting on vaccination. Now, the country as yet does not have a mandatory vaccine policy. And therefore, and in any case, as we have maintained all along, vaccination is not a prerequisite for schooling. Other childcare institutions such as Anganwadi centers, these have a logic of their own in terms of child development, in terms of child education, and so on. But anecdotal evidence remains that schools are often making it quasi-mandatory, or there are pressures of various kinds. But that's certainly something that needs to be made very clear by the state governments or local authorities, that India does not have a policy of mandatory vaccination.
Last question, Dr. Dasgupta, and on the overall COVID numbers, which are inching up, are you worried? Should we brace for another wave?
Well, what is certainly true is that there are these newer Omicron subvariants, which is BA4, BA5, and BA2.12.1. These are very highly transmissible. These seem to have very high immune escape properties, means that even if you receive 2 doses plus a booster, you may certainly get the infection, though it's most likely to protect you against severe hospitalization, complications, etc. but it's something we need to watch out for. It's certainly increasing at a pretty rapid rate, and it would be naive to believe that there aren't any other variants also. We expect, or we should have greater transparency in terms of what the genome sequencing picture is from institutions such as INSACOG, so that they can provide adequate guidance.
All right. Thank you so much, Dr. Dasgupta, for joining us and taking some of those, I assume, are FAQs on vaccine for kids. Well, the aim should be to protect all of us. An announcement has been made, in fact, by the government today that 86% of all adults are now double vaxxed in the country. So that's great news as well. Thank you once again, sir.